this is Dr. Akshata. Today we are learning about the cyst. Cyst is a very important topic for your clinical practice as well as in your exams. So let's start with the definition. Cyst is a fluctuating soft swelling containing fluid in the side lined by epithelium or endothelium. You can see here the appearance of the cyst. Okay, see what happens in the cyst. Cyst is a cavity formation where there is inside a fluid collected which is surrounded by or lined by a capsule, and this can be occurred at any site on the body. Okay, so this is the cavity which is filled with the fluid. For example, it can be filled with mucus, pus or exudate, and this is which is lined by the margin is known as the capsule of the cyst. Now we have come to the classification of the cyst. Here is the classification of cyst. This is the first classification where it is classified into true cyst and false cyst. First we'll see the true cyst. True cysts are lined by epithelium or endothelium, or we can say the true cysts, the lining of cells that separates it from nearby tissues. The content of a true cyst is like porridge-like or toothpaste-like, and the fluid which contains is serous and mucus type. The fluid can be colorless or to the brown. For example, true cyst can be like dermoid cyst, epidermoid cyst, brachial or sebaceous cyst. So these are the true cysts. Then we see here the false cysts. These are not capsulated or closed, so they don't have linings of epithelial cells that separating from nearby content. So it can contain exudate or degenerative material which is related to the surrounding tissue. So here the two types, exudation cyst and degenerative cyst. In exudation cyst, the area or these the cysts which are limited to the anatomical place and the exudation of fluid containing the cells affected. For example, pseudopancreatic cyst. In degenerative cyst, there is degeneration of the entire malignant tumor cells which contains the necrosed materials inside it. This is the another type of classification of cyst. Cysts are differentiate into the two types. One is congenital cyst and another is acquired cyst. In congenital cyst, these are the cysts which are present along the line of embryonic fusion. Also, these are filled with tissues that are normally found in outer layer of a skin. May contain sweat, oil glands, hairs, tooth, and etc. For example, the sequestration cyst, tubuloembryonic or tubulodermoid cyst, cyst from embryonic remnants. These are the congenital cysts. How it forms? Generally what happens when two opposing tissues approaches one another and integrate to form a new organ, that is a continuous tissue formation. But when there is a disruption in this process, there are chances of formation of congenital cyst. The another type of cyst is the acquired cyst. These are the cysts that are present during the life processes at any part. Also, they can occur at any sites. For examples, we'll see few examples: retention cyst, distension cyst, implantation dermoids, and etc. We'll see later in detail. Here, take a look of congenital cyst. The first type is sequestration dermoid cyst. Here, these are the sequestration dermoid cysts which occurs along the line of closure of embryonic clefts, midline of a body, midline of a neck, and at the outer edge of eye. These are the cysts which are filled with tissues that are normally found in skin. For example, hairs, teeth, sweat glands, etc. That's why they are known as a sequestration dermoid cyst. What actually happens in dermoid cyst? See here that during embryonic fission, the dermal cells get sequestrated in the subcutaneous tissue plane. After that, these cells get proliferate and later undergo liquefactive necrosis. These necrosed tissues get collected in the form of a cyst. Sometimes this cyst slowly grows and indents in mesoderm also, which may cause a bony defects. Here is the diagram. We can say here is the bony indentation in the bone due to this sequestration dermoid cyst. This is the second type, tubulodermoid or tubuloembryonic congenital type of cyst. These are the cysts which arises along the ectodermal or endodermal tube or in tubular structures in the tract of ectodermal or endodermal tube development. For example, these are thyroglossal cyst, post-anal dermoid cyst and ependymal cyst in brain. What happens in tubulodermoid cyst? There is persistent epithelial secretions from the glands which get accumulated in the tubal structures, ultimately results in a swelling and collected as a cyst. We'll see here the tubulodermoid cyst example is thyroglossal duct cyst. Here it is. See. The thyroglossal duct is here and the collection which accumulated and formation of cyst is here. So it looks like this. This is the appearance. This is the third type of congenital cyst, that is the cyst from embryonic remnants. These are the congenital type of cysts which arises from embryonic tubules or ducts which normally disappears. For example, cyst of urachus and vitellointestinal duct and remnants of mesonephric duct. What happens in embryonic remnant type of cyst is the epithelial remnants are the rest of epithelia that serve once as a meaningful tissue in embryonic development. While epithelial cells supposed to disintegrate ectomesenchymal invasion and are programmed cell death, some cells persist as a remnants and this develop into the cyst. We'll see here the example of cyst from embryonic remnants is cyst of urachus and vesicourachal duct. So here is the example. This is the umbilical, the part which is remnant, and here the cyst is formed. Here is the second type, acquired cyst, and we're looking for the few examples and types of it. So first is retention cyst. What happens in retention cyst? They're the secretions of glands which are getting obstructed due to any obstruction in the glandular outlet. For example, sebaceous cyst, pancreatic cyst, mucus cyst. The second type is distension type of cyst. What happens that there is a natural enclosed cavity that leads to distension of normal acini or follicles of a glands and lead to a formation of swelling. For example, thyroid cyst, lymphatic cyst, cystic hygroma. Then third type is exudation cyst. In this type of cyst, there is exudation of a fluid and collected it into an anatomical space already lined by endothelium. For example, vagina hydrocele, bursa, pseudopancreatic cyst. The fourth type is degeneration cyst. Here, fluid accumulates due to degeneration of a central material of malignant tumors due to hemorrhage or any ischemic necrosis. For example, apoplectic cyst. This is the fifth type, implantation dermoid cyst, where in the squamous epithelium of the skin is driven in by penetrating bone and there is formation of a cyst. Sixth is Dramatic cyst. Due to any injury to the tissues, there is a hematoma formation in muscles, fascia, or subcutaneous tissues, which leads to the formation of cyst. Seventh type is parasitic cyst, where cysts develop due to parasitic infestation. For example, hydatid cyst of liver, which is due to Tinea echinococcus. Eighth type is cystic tumors. These are the development of tumors with cyst consistency in organs. For example, dermoid cyst of ovary, cyst adenoma of breast. These are few examples of an acquired type of cyst. Clinical approach to the cyst. While taking history, the following points are important. First, the duration of swelling is important. Is it from birth or of a recent origin? Then, how did it appear? Is it spontaneous swelling or following after any injury or any disease? Third point is pain. Is this swelling is painless or painful? Usually inflammatory or due to secondary infection, the cyst may be painful. Fourth point is growth of a cyst. Is cyst is growing fast or it is slowly? And the last is general health of a patient. Is patient is suffering from anemia, anorexia, cachexia? These points of history are important for diagnosis of a cyst. Here we are going to learn about the physical examination of a cyst. While inspecting, the site is very important, at which anatomical space the swelling is present. Then second, number. Is there multiple cysts, small cyst, or there is a single large cyst? The surface. The surface is very important as it contains the fluid. Sometimes it is smooth and sometimes it is hard. Then margin. Is it regular or having irregular margin? Then we see the palpation, how to palpate and examine. As the surface and margin looks smooth, spherical and irregular. The consistency is soft as it contains the fluid. The fluid thread web test is positive, and then the translucency, it is related to the clear fluid, especially in cystic hygroma. If it is not clear fluid or may contain exudate or any degenerative material, the translucency may not be present. Here, take a look of effects of cyst on the surrounding tissue. Sometimes there is pressure on neighboring structures, especially blood vessels, that will lead to the venous congestion of affected organs. For example, in ovarian cyst, there is varicose veins in lower limbs due to the pressure effect of ovarian cyst on the lower limbs venous cysting. The another effect is the pressure on surrounding or neighboring ducts that leads to the cyst formation in affected glands. For example, there is colorectal cyst on common bile duct. Further important topic for cyst is the complications of a cyst. What happens if cyst is not removed or cyst is remain for many days, for more time? Then following are the complications that can happen with the cyst if they don't get treated on time. The first is infection. There may be secondary infection to the fluid contained in it. Also, there may be the hemorrhage. Third is the torsion. The cyst, when progress to the more size, there may be chances of torsion. And then there is a last type, that is calcification of cyst also can be happen. Now we have come to our last part of the topic cyst, that is its treatment. Surgical management and removal of cyst is very important depending upon the size and severity of cyst. And according to the homeopathy, there are few remedies which are also effectively work in this cyst, but there is need to be an expert opinion So I hope you people have learned more about the cyst, and I think you all loved it. So if you like this topic, so please like, share and subscribe my channel for more other medical topics. So thank you and take care. Bye.